Hello everyone, and welcome to my channel. Recently, my daughter had her wisdom teeth removed. So these are her instructions for after her surgery. Oral surgery post-operative instructions. Activity. After your surgery, plan to relax for the rest of the day. For the next 24 hours, do not drive a car or operate any heavy machinery. Do not engage in any strenuous activities, such as running, lifting heavy objects, or swimming. No heavy lifting for 1 week following wisdom teeth removal. Avoid infection. After the extractions, a blood clot forms in the socket. It is important to keep this blood clot in place to prevent post-operative infection and/or a dry socket. To minimize risk of infection, please do not rinse vigorously, spit, or disturb extraction site with your tongue or fingers. Do not use straws for at least 1 week. Do not smoke or vape for at least 1 week. Do not drink alcohol for 24 hours. Bleeding. After tooth removal, it is normal for blood to ooze from the socket for 24 hours. To help minimize bleeding, do the following. Avoid spitting to ensure that you don't remove the blood clot from the socket. Bite down on the gauze that have been placed for 1 hour after surgery. If active bleeding persists, place new gauze and change as necessary, typically every 30 to 45 minutes. You may use a wet tea bag in place of gauze. Do not lie flat. Elevate your head with a pillow. Diet. Food. Eat only soft foods, such as yogurt or mashed potatoes, for the first 24 hours. Over the next several days, you may gradually progress to soft, solid foods. Do not eat spicy, hard, chewy, crunchy foods or foods that might get stuck in the socket or irritate the wound, such as berries, sunflower seeds, and popcorn. Beverages. Drink lots of water after the surgery. Don't drink alcoholic, caffeinated, carbonated, or hot beverages in the first 24 hours. Don't drink with a straw for at least 1 week. Stitches. Sutures may be placed to help with the healing and will dissolve within 7 to 10 days. Pain. Unfortunately, it is common to experience some degree of pain or discomfort after oral surgery. Taking prescribed medication as directed should help control discomfort. Taking pain medication with a small amount of food can reduce nausea. Do not drive while taking pain medication, as it can make you drowsy. Swelling. Swelling and bruising is normal after oral surgery and can be expected to increase over the next 3 days. To minimize swelling, wrap ice pack in a towel and apply firmly to the cheek adjacent to the surgical area. Apply ice pack for 20 minutes on, then 20 minutes off for the first 24 hours after surgery. Oral hygiene care. For the first 24 hours after surgery, do not brush, vigorously rinse, or spit. You can go back to brushing your teeth after the first 24 hours, being very gentle around surgical sites. Do not vigorously swish or spit. Tilt head side to side over the sink to let the water fall out. 72 hours after surgery, use the prescribed mouth rinse 2 to 3 times a day for 1 week. Smoking. Smoking and using tobacco products after oral surgery can delay healing and raise the risk of complications. Do not smoke for at least 72 hours to 1 week after surgery. If you chew tobacco, don't use it for at least a week. Please go to the emergency room if you are experiencing any of the following symptoms: difficulty breathing or swallowing, persistent nausea or vomiting, fever over 101 degrees for over 24 hours, excessive bleeding that cannot be controlled by biting firmly on gauze, severe pain not relieved by prescribed pain medications, a bad taste in your mouth or discharge that is not alleviated by oral hygiene. Post-operative instructions for orthopedic surgery. Medication. A certain amount of pain, swelling, and bruising is expected for the days following surgery. The goal of post-surgical pain medication is to control and manage post-surgical pain, not to eliminate it. Most patients will be given a prescription for a narcotic pain medication, Norco, hydrocodone, that is initiated shortly after surgery. Take it only as needed after your discharge. Common side effects of the pain medication are nausea, drowsiness, and constipation. To decrease the side effects, take the medication with food. An over-the-counter stool softener may be taken to prevent constipation. You may not drive or operate heavy equipment while taking narcotic pain medicine. Call the office immediately if you are having an adverse reaction to the medication. Resume all home medications unless otherwise instructed by your doctor or your primary care physician. You may be recommended to take a blood thinner, which is individualized to you based on risk for clotting after surgery. The type of medicine is determined by your doctor and your surgical team. Commonly, this medication is aspirin twice daily, started the day after surgery and continued for a few weeks. Wound care. It is recommended you leave in place the bandage you left the surgical facility with until the 5-day mark after surgery. It is recommended the incision remain clean under that bandage for those days to prevent infection and promote early healing. You may shower with a sealed bag over the bandages during that time, ensuring the bandages remain dry. Once the bandages are removed, the incision can be left open to air or replaced with a gauze or ACE wrap. Do not apply lotion, cream, or ointments to the incision. Showering is permitted at 5 days with gentle soaping, and you can let water run over the staples and the front of the knee at that time. Please avoid submerging the knee in a bath for a few weeks after surgery to prevent contamination of the incision and infection. Mild bleeding and swelling is normal. If blood soaks onto the bandage, do not become alarmed. Reinforce with additional dressing. If there is excessive drainage from the surgical incision requiring multiple reinforcements and dressing changes, please contact the office to inform your doctor and the surgical team. If there is excessive redness or drainage from the incision or fever greater than 101 degrees, contact your doctor and the surgical team. Lower grade temperature elevation for a couple days after surgery are normal and should not be a cause for alarm. Cold therapy. Ice can be applied through a clean plastic bag, or a bag of frozen peas accomplishes the same objective. Formal icing machines are not covered by insurance and are not routinely used, but your doctor supports their use if you have access to one. Never apply cooling agents, such as ice or polar care, directly to exposed skin. After the first day, use 20 minutes on, 20 minutes off, as long as it continues to help with pain. You may discontinue when you feel the cooling is no longer helpful. Consider using ice after physical therapy to help with swelling and pain. Activity. Keep the involved limb elevated for several days to help with swelling. Depending on your limitations after surgery, several exercises will be beneficial for you at home. Quad sets, ankle pumps, and straight leg raises should be done 3 to 4 times per day. Being up and around after surgery will help diminish the risk of blood clots. Formal physical therapy will typically begin within 2 weeks of surgery. Return to work. Returning to work depends on the type of work you do. Patients in seated jobs may return to work in as little as 1 week if demands on you are limited and you have transportation arranged. You will possibly be taking narcotic pain medications and not have the ability to drive. Patients with higher demands may require a longer time frame, and your doctor and his team will discuss this with you. Please let our office know if you need assistance with paperwork for your time away. Emergencies. Call your doctor if any of the following are present: uncontrolled nausea and vomiting, uncomfortable or painful swelling that affects the surgical leg much more than the other normal one, unrelenting pain at the knee or pain in the calf, fever greater than 101, redness or continuous drainage around incisions. If you are having chest pain or difficulty breathing, call 911 or go to the closest emergency room immediately for evaluation.